So I'm Shashi Yumbe, I'm the CEO of Level 42, and I'm going to be talking to you about a new technology platform that you may never have heard before. So for those who've been paying attention to ChatGPT, I'd like to emphasize that in healthcare, it's not really the chat that is important, but the G and the T, generative transformers. And Level 42 AI has been quietly building generative transformers informed by novel human health data that's underlying a new science that you'll be hearing for the first time today, which we call the vibrome. Right, so if we were cars, we would have check engine lights. Instead, the current health paradigm tends to react to disease and to symptoms. And almost always we catch disease too late. The vibrome health alarm system that we're introducing offers early disease detection, monitoring, and diagnostics for a comprehensive continuum of well care. The early diagnostic space that we are addressing is massive and growing, especially with the aging population, and we can cover lung diseases, heart diseases, gut diseases, and this also includes cancers. This is how our technology works. Our eyes, you may be aware, they only see a limited bandwidth of wavelengths, and our eyes only hear a limited frequencies, and our hands only feel very limited energies that are generated by the human body. Our novel sensors capture deep and frequent inaudible frequencies, invisible wavelengths, and imperceptible energies that are generated by the movement of fluids and gases and waste within and between tissues that are uncollectible by current instrumentation. We then use our algorithms to extract insight from these novel data and are able to detect diseases before they're actually symptomatic. We've been able to validate our solutions and this data that we're collecting to demonstrate accuracies that are greater than 97% for diastolic, systolic, and mean arterial pressures versus sphygmomanometer. And we recently won the J&J Inspire Quickfire Challenge for diseases that impact the Black, Indigenous, and people of color communities. We also have demonstrated that our solutions can actually listen to the human body and treat it as a musical instrument to be able to detect exposure to different pathogens. And we're currently validating the system for sensitivity and specificity against COVID-19, RSV, influenza A and B, dengue, and we'll then move over to asthma and COPD. So note, we don't actually listen or pay attention to the pathogen, but we actually look at how that pathogen is eliciting certain responses within the human body, and that's what we are essentially tuning our solutions to. Our integrated business, IP, and regulatory strategies are all aimed at creating a data and algorithm mode from our tip of the iceberg, our competition, which is focused and concentrated around audible sounds or visible light solutions, whereas we go very low in the frequency range in the areas that are related to the movement of gases and fluids in the body that are related to digestive sounds, heart sounds, as well as any changes that are occurring very early. We are hardware enabled, software as a platform solution, and we feed into the we're really feeding into a creation of a formidable exclusive data and algorithm platform and marketplace to extract the full value of the human body as the deepest data platform. And one way to think about this is we essentially are building up a Shazam app of all the sounds and vibrations that are generated by the body. And similar to Shazam app, as well as Spotify, we can then leverage this knowledge graph to extract and diagnoses very rapidly using point of need solutions that we are generating, and then can also end up using the phone and other solutions. So as far as our beachhead, we are currently going after lung health as our focused hair on fire solution. And the goal here is to demonstrate that we can impact accuracy of triage and timeliness that is really impacting a lot of the ERs around the world at the moment. We have a paid proof of value workflow optimization study that is planned for the next 3 years, which is an incredible opportunity for us, not only to generate revenue, but also to garner credibility because of the partners that we're working with, and this announcement will be made over the next few weeks. But then the real value of this solution, besides the credibility, is also to use this proof of value test to demonstrate that this can be a launch pad for us to start going after the areas and the markets and the verticals that we are most interested in, which is use at home, and also use of our solutions in areas where you can't use any other solutions, like the ambulances, because of the vibrations that come from the movement, and helicopters, as well as in the ICU, where because of ventilators, etc., a lot of the solutions, including SpO2, are usually turned off because they just cause a din, but our solutions work effectively. And of course, what we really are after is this idea of data and algorithm domination in areas where our solutions can be rolled out, because we know that more data leads to more learning and more AI applications across more verticals, and more learning and more AI applications lead to better products that we produce, and of course, more users, and on and on. And we've already been able to show incredible traction for a lean and mean startup with close to $1 million in sales to date, as well as winning the Operation Warp Speed grant that has enabled us to make the progress that we've demonstrated to date. Our team is small, but multidisciplinary and bonded by this idea of going after novel data and creating algorithms that are going to change the face of digital health diagnostics. And we've been able to do all the work that I've been talking about so far, off just $2.1 million in cash. We have our first FDA approval submission that is going to happen in 55 days from now, and we're counting, of course, because that's an important milestone for us. And we have an open Series A round right now for $10 million, and we're looking for courageous capital that is legacy-minded to help us bring this new science that turns sick care to proactive preventive care for ourselves and also for our loved ones. And I'll be happy to take any questions.